My name is Dr. Lewis from Chiropractic Brighton Hove Shockwave, and today we're talking about how Shockwave works for erectile dysfunction so that you can understand the process. So here we've got a model of the penis, and inside the penis we've got little cavernous areas, and that's where the blood perfuses through to create an erection. As we get older, things like diabetes, obesity, alcohol, smoking consumption, drugs, mobile phone use, etc. create a degradation to the arteries or blood vessels to the penis. The blood vessels to the penis are very small, so they're drastically affected by things that would create an effect upon your cardiovascular health, like I said, such as obesity. What then happens is the number of blood vessels through the penis reduces, and what we do with Shockwave is we apply Shockwave, which is sound waves, to the shaft of the penis, and it breaks down scar tissue within the shaft, so within these fossas here. Over time, by stimulating it weekly with Shockwave, we create new blood vessels as seen here, so that more blood can penetrate to the end of the penis, allowing for greater duration of an erection or greater firmness. And how we measure this: when you first come, you'll have an internationally recognised survey that we go through to score or grade the dysfunction, and when we get to the end of treatment, we'll also do it again. Results are very long lasting. On average it's 2 years, and very few patients need a lot of top-ups past that. The average is about 6 to 10 sessions. Thank you.